This is a totally different issue that I'm about to talk about. I am the director of the Institute for the Life Course in Aging at the University of Toronto. And one of the things that we have there is a National Centre of Excellence. It's called the National Initiative for the Care of the Elderly. And I know you have a NICE in Britain, but it's Canada's NICE, and it's a different NICE. Okay? So don't tell me. I know that's already. And it's a very prestigious group here. What I'm doing, the only reason I'm here twice is because I'm presenting on behalf of my program coordinator who runs one of the programs out of NICE. And it's called the Elder Abuse Knowledge to Action Project. And what I just quickly want to say is that the National Initiative for the Care of the Elderly is a national center of excellence funded by the federal government that was formulated to do only one thing, and that was to transfer knowledge. And back like 5 or 6 years ago, we didn't know what that meant, but we worked on it and figured it out. Put together a national network that started with 40 people. It now has 1,500, 600 people, members. All we do is meet and hang out together and develop. It's great. And we develop tools. And we develop what we call pocket tools, which are these. You can put it in your pocket. It's really easy. All of our pocket tools are primarily based, again, on evidence. In other words, we use, again, the Cochrane and the Campbell collaboration to develop our information, or we do systematic reviews of the literature, and then we turn it into something really, really simple and straightforward. And that's what some of you have in your hands right now, are those pocket tools, which also represent the continuum from the university to the community. They are interdisciplinary, and as I say, they're evidence-based. Where we started out was with about 10 tools, and now we have over 100. The ones that you have in front of you today are primarily to do with abuse of older people. And there are way more on mental health, on the law. We have one on consent and capacity. We have a number of tools on caregiving and so on. We have a whole bunch more, but this is our suite on elder abuse. What we have had requested of us in Canada is, on average, we get requested 12,000 to 13,000 requests a year for these tools. We don't advertise. People want them, and they're using them. But we haven't evaluated whether or not they're effective, regrettably, because no one will fund it. But anyway, we've had 350,000 requests for these tools, which is quite a lot. And they are used by everyone from physicians through to police officers, psychologists, anthropologists, you name it, everybody's using them. So this is a project of NICE that I'm going to report on today. We have a huge structure. You can go to our website and look at all the NICE stuff if you're really interested. But anyway, we have a 3-year project that was funded by the Human Resources and Skills Development Canada. And what they wanted us to do was to develop more evidence-based tools in conjunction with people in the community in both French and English, and more languages besides that in 5 major regions. And so what we did is that we put together a project where in the 5 regions, we decided that it's better. For example, NICE has older adults have their own committee. We have 7 theme team committees. One of them is elder abuse. And older adults are part of all of our teams. And they vet every tool that we develop. So what we decided is that we were tired of seeing older people go out into the community and try and convince other older people about elder abuse. We thought that maybe if we put together a team of an older person and a researcher, practitioner together, that they could convince their audiences much better about awareness of elder abuse and intervention and what you might do. So what we did is we had 5 coordinators, senior citizen coordinators across Canada that work with researchers and practitioners, and what they have been doing is developing a new suite of tools where they take the original tool from the research with the senior citizen and the older adults, and they work out together what the tool should look like. So as a result of this piloting and dissemination project, we have a whole new suite of tools that Alison Leaney, who is the project coordinator, was going to present to you today. And then I'll quickly go through the tools, some of them, and then Ariella Lowenstein, who is, I will say NICE, has 9 international partners. Britain is one of them. Bridget Penhill has worked with us, as has Simon Biggs, as has somebody else. I can't remember who, because it was a long time ago. Anyway, we have 9 partners from 9 different countries. So, for example, we have some of our tools in Zulu. All of our tools are in French and English. Some are in Spanish, and some are in German, Mandarin, and Cantonese. So I just brought the English ones with me today because they're heavy. Okay, the detection tools that we have developed are, one of them is the EASY tool, another one is Base Case Iowa, and the Z card on for women. The EASY tool in English is the Elder Abuse Suspicion Index, and it was developed by a Canadian doctor, Mark Yaffe from Quebec. Maxine Lith, she's a social worker, and Christina Wolfson is a sociologist. So we have an interdisciplinary approach. It only has 6 questions. It was designed to be used with people who are mentally alert, no problem. And it was originally designed for physicians, but we have now expanded it to be used by anybody. Social workers, nurses, doctors, anybody can use it. And it's been adapted for use in different countries, and Ariella will talk about that in a minute. Do you want to talk about it now? Okay, keep going. Okay, we just did a study of 23,000 family physicians in Canada, and it takes them 2 minutes to fill us out. They love it because it's quick, and they know right away time to call a social worker. Another detection tool was developed in Quebec as well by Drs. Myrna Rees and Daphne Namish, and the base is tells you basically how urgently how urgent is the situation, and does it need to be addressed right away. The case screens caregivers for potential signs of abuse, and the Iowa is training practitioners to recognize the signs of potential abuse. And again, those small ones are in your package. The resources for older women has been a very popular tool that we've been giving out directly to older women. The first one is a Z card, so it's a little tiny thing you can slip in your purse. And I didn't give you one because they're really expensive. And believe it or not, I have to have them made in England for Canada. Go figure. But it's really excellent because there's no, you can't tell what it is. You just pull it out and it has all the resources required in whatever province you're in Canada. We have another version of it, the Row, which primarily we've related it to the 5 regions in Canada because there's so many services available that we have to go regionally. In terms of intervention tools, I would like to make a comment about intervention. There was just a brand new study that did a systematic review of all interventions in elder abuse and found that there were, out of 1,563 studies, 8 might have passed the test. And of those 8, you couldn't tell whether it was a good thing or a bad thing, which is really has to say something about intervention. We have one of the authors of our intervention, one of our interventions tools, which is the En Main, or In Hand, developed by Marie Bellew and the Elder Abuse Theme Team of NICE. And Marie is from Sherbrooke University. It's a framework to guide the psychosocial professionals like social workers, healthcare professionals in ethical decision making in suspected or confirmed cases of elder abuse. And there are 3 types of scenarios involved, and it was originally developed in French and is now in English. And there is a video if you want to go and check it out online. And if you want to talk to Marie, she's sitting there in the orange jacket, and she can tell you about the tool. The detection intervention tool for police was actually developed by the police with social workers and nurses. We actually have quite a few more tools on intervention for police as well. This is just the one I brought. And again, it helps police officers check for forms of abuse, talks about intervention strategies, safety, privacy issues, and possible interview questions. The intervention orientation to practice is based on the literature of cultural safety for Aboriginal models of wellness. So I don't know if this is appropriate to many of you, but this is used in our Aboriginal communities, and it's based on the medicine wheel. Theft by persons holding power of attorney is a big one in Canada. Again, this is for the police, and it outlines the steps police can take to do what they need to do if there is a theft for mentally capable and incapable people. The Be Safer tool is actually from British Columbia, and it's been amended by NICE. And safety planning risk assessment tool, which is used in domestic violence. Originally, that's how it was developed in British Columbia. And it focuses on physical and emotional abuse. And it's been amended for non-couple abuse, because that's not always the case in elder abuse. And that one is just being piloted with the police as we speak. Financial exploitation tool is negotiating. We are negotiating with researchers in Chicago right now who've actually developed a phenomenal tool with many items that they're testing right now. And we're going to be working with them to develop this further, because again, we're looking for evidence-based information as opposed to I think, I feel, or it could be, or it might be. And this tool is really excellent, but they have yet to use it. In terms of prevention, we've tried to develop what we call, nothing's perfect, an ideal coordinated response, which is a whole community response. If you live in a community and you want to organize your community to deal with elder abuse, this particular tool will give you some of the basic facts that you need in order to get that community together working on elder abuse issues. We have another one, preventing financial abuse. I have to say we have another grant on financial literacy from the Status of Women Canada. And financial literacy has developed something like 20 different tools around financial literacy for older women and immigrants and for men. And you can pick that up off our website. But this one is particularly related to financial abuse. If you want to take a look at it. And again, it's based on what we know about financial abuse in the literature, which isn't a heck of a lot. So there's a summary of the toolkit, and I'm going to have Ariella talk as a member of NICE representing Israel, who has taken the easy tool and adjusted it for Israel.
I want to thank Lynn and say that I am one of the 40 people in the group when NICE have been started, and it was a pleasure to watch the development and to come and smooth around, as Lynn said, and maybe go to a nice dinner like we did last time, about 3 weeks ago. But I think really very challenging work had been put forward. And when I saw the Easy tool, which was developed already a few years back, I thought this is a very important tool, because at least in Israel, every person has his own family physician who knows him or her for many years. And there are many times the first person that an elder will go, of course, usually with the physical complaint, but sometimes even just to talk. However, these family physicians are overburdened. Officially, they have 10 minutes to talk to or to examine a patient, and They have to write on the computer, so how much can they do in 10 minutes, and they don't have enough, they don't usually have a specialty in geriatrics, and they don't have enough knowledge, definitely not about elder abuse. So when I saw this tool, I thought this might be an excellent way to start raising awareness and to help these physicians. So we took the tool, we did the usual translation, back translation, and then in Israel, in every hospital in Israel, you have violence committees who are in charge of reporting all types of violence, including against the elderly. They are usually manned by a physician, but the chief social worker, the chief nurse of the hospital, etc., are involved in these committees. So after we did the translation, back translation, etc., we went and had focus groups with 3 of these committees in different hospitals around Israel, and there were fascinating things that came out, and they gave us a feedback about the tool. Then after we changed not much, we took it to 10 physicians and let them look at the tool, use it in their practice, and give us their feedback. And after all this, we think we have a tool which is valid also in the Israeli context. It takes them between 2 to 7 minutes. And they were, most of them, we are now finished data collection from about 100 physicians, and we want to go to other professionals. Most of them said that it really helped them really think even about the issue of elder abuse, which they didn't before, and they wanted more knowledge, and we're trying to organize some workshops, etc. But this gave the impetus to start looking at this, and we are trying now to develop some training programs, not only to use the tool, but to expand it on the issues of elder abuse in general. I know that something very in a pilot stage started in Germany, and I didn't yet hear more from our German colleague, and I hope it will start in the UK as well. So I think this tool, and this is the easy tool, again, the pocket tool, I think many of these tools are worthwhile for people to take into their own countries to think which is the immediate burning issues that they want to try to use any of the tool. We hear so much about financial exploitation, and there are many tools for this, and also use it as an educational tool around the issue of elder abuse in general. Thank you.
I just want to say one more thing. I'm sorry. If you all have handhelds, iPads, whatever, all of these tools are going to be downloadable in a nice format to use on your handheld, along with a whole aging hub that's being set up called Aging App at NICE. So you can just go to NICE and look it up. It's a beta site right now, and if you want to try and go in and use some of the stuff, and provide your feedback, or provide feedback about what you think we should be putting up in our hub. If you have stuff that is evidence-based, we'd love to have it. Thank you. Sorry, Bridget.
Just very quickly to provide a little UK context. As Lynn said in her presentation, I'm linked to the NICE group and to the Elder Abuse Theme Team. A couple of years ago now, I did take the EASY tool, which is the physician-based tool, and I had a couple of focus group meetings with clinicians, with doctors, about potentially using the tool and whether it might be adaptable for a UK context, and they were very positive about it. Now, since that time, with a group of doctors, we've been trying to get some money to run a pilot, but so far we haven't done that. We're still trying to, under various funding streams, because their view was that it's a very brief tool. It is 5 questions and an observation that the doctor has to make, and their view was that actually, yes, it could also be used for education. We've also done some initial work around looking at the in-hand tool, which is predominantly for social work practitioners, and that again I undertook several focus groups and got some feedback about how feasible it would be to run something based on the in-hand tool, to adapt the tool in a UK context, but we haven't developed that work further in the last year or so. So I'm hoping to be able to do some of that work, and if any of you are interested in finding out more or being involved in some of that, then obviously please do get in touch. Thank you.
We have time for a couple of quick questions. If you have any you'd like to address about the tool. Yes.
Yes, thank you. I'd like to ask Dr. Vansky, what kind of adaptations did you need to make with the easy tool to adapt for use in Israel?
Well, there were some questions, especially the question about financial abuse, and people are very sensitive to this issue, that we have to rephrase a bit so it would be more comfortable for the physician to ask the elders about this issue.
Because the question as it stands now is, has anyone tried to force you to sign papers or to use your money against your will? That's the wording. Then we'll move on to the next session, which deals with education and training and some of the new developments. And we have 3 speakers here. Let us begin with Esther Grau, who is the coordinator of the master's course on elder abuse at Valencia International University.
Good afternoon. My name is Esther Grau Alberola, and I work at the Valencian International University. I'm not a native speaker of English, but I will try to convey the meaning. VIU was founded in June 2008 as a non-profit making university using cutting-edge technology. VIU is a new type of university where teaching is online. It allows you to learn by watching and communicating with some of the world's leading experts through your computer screen. And I'm here to talk about the Master in Elder Abuse, Risk and Protection. This master is directed to any professional working in the field of prevention, protection, and intervention with older people at risk of abuse. The direction master course is Isabel Iborra Marmolejo, and you know her. Well, I think it's a very interesting master for psychology, psychiatrists, social workers, youth, prosecutors, lawyers. Why this master? This master has been designed to meet the training needs of professionals dedicated to caring for the elderly people. Healthcare professionals receive relatively little training in geriatric care. It is therefore very important that training is aimed to caregivers, health professionals, but informal caregivers too. Why? Because we have to improve life quality and reduce the stress associated. In fact, many institutions, national and international, have claimed in their reports the need for training in elder abuse in the family. And we think it's very important to raise awareness and train caregivers from a holistic and interdisciplinary view. Well, as we see in the previous studies, the prevalence data alone justify the need for a special training. And according to the only research on elder abuse in the family that has taken place in Spain, at the national level by the organization Chris Sophia Center in 2008, 0.8% of the elderly recognized having been abused in the previous year, and 4.6% of the caregivers recognized have abused the elderly in charge during the previous year. Thus, caregivers recognize the abuse more overtly than older people. in this context, the elderly are very reluctant to talk about this situation because of several reasons: shame, sadness, helplessness, and even physical or mental disabilities leading to secrecy. Even when abuse is detected, many victims do not recognize it and refuse to denounce the dependency relationship established. So we think it's very important not only to talk about the domestic violence, but we must talk about the caregivers that are in the institutional too. And so it's important to note that aggression can happen in the family, but also inside an institution. In both contexts, we can see that a long-term occupational stress can lead to burnout because the response developed against the stress has a negative impact on attitudes and behaviors of the professional. This results in symptoms of emotional exhaustion, reduced accomplishment, or depersonalization. In the same study, in 2008, 72% of caregivers engaging in abuse feel overwhelmed by their task, compared with 54% of non-abusing caregivers. So, in my experience of 12 years in elderly homes and with disabled people in homes, I see that I really think that one of the greatest dangers faced by professionals is falling into the depersonalization. Too often, depersonalization or cynicism is a strategy to cope with pain and suffering. So this can lead to institutional abuse that directly affects the process of elder care. That's why we are thinking about a master in elder abuse, risk and protection. Our approach is multidisciplinary and methodological innovative. VIU works closely with other academics across other national and international universities who are engaged in research and practice in this area. And this master focuses on two interconnected fields: learning research and professional learning in work-based context. And the master has two possible orientations, professional and research. With the professional one, you can practice and enter in the labor market, and with the research, you can enter to the PhD. Prevention and intervention in case of elder abuse require an interdisciplinary approach, which is why this master includes professionals of different fields: forensic psychology, clinical psychology, social work, sociology, nursing, medicine. The methodology of the university allows us to have a lot of persons because it's online, and you can learn and you can teach in your computer screen. The content of the master course, as you can see, there is some obligatory contents, external training only for the professional itinerary, and a final project for both itineraries. We have 4 modules. The first one is about the phenomenon of domestic violence, elder abuse, and the subjects was sociology of aging, concept and risk factor of elder abuse. In the second module, we are talking about primary and secondary prevention on intrafamiliar elder abuse. We talk about the programs and strategies, the scene of detection, and legal protection. The third module will be the interventional, psychological, and social intervention with victims, with caregivers, and with aggressors in the familiar context. And finally, we have the practicum and a cross-seminar about family relation and care. What methodology? You may be wondering about about our methodology, and teaching is online. We have audiovisual interaction between the students and faculty. I will put a video, short video, and you can see it. It faces interaction, personalized, and effective attention. And you have a basic test in PDF. The students have this test. It's an interactive test because in the test you have links with internet, and you have, for example, is music, and you can see. You only need a computer and connection to internet. Anyone logging on for the video conference is able to see and be seen, and hear and be heard. And it really is a real class, live classroom. We have two supports. Illuminate is one we can use, Illuminate, or Spontanea. With Spontanea, we have the possibility to ensure the simultaneous translation into different languages and allows them captioning. It's very interesting, this one, because with the other, only you can take 6 persons in the same time with the camera. And so you are teaching, but you can't see the students because if there are, for example, 30 or 40 students, you can see all them. But with Spontanea, you can see all the person. And it's in real time. The structure of the subjects is a personal and group tuition. There are seminars, most are cross seminars or annual seminars. We have discussion forums, hors d'oeuvre, and literature review, and guide activities. Normally, what we do is there are 3 kinds of teachers. The experts normally, he usually record a video, and he take the class more important for the students, and after the teacher of the view teachers have the guide activities, more practice. In conclusion, the Master in Elder Abuse, Risk and Protection is a pioneer initiative to address exclusively the specific problems of the elderly who are victims of abuse in the home. This master responds to a need established by prestigious national and international institutions, and the university is committed to quality in the following the indication of Bologna, and it pays special attention to tutorial seminars and work experience placement or guide activities. BIU is not only dedicated to teaching, but also to encouraging its teachers to share their time with teaching and research. And this new type of university will be able to make the educational dreams come true for people who are previously unable to do it because of the distance and linguistic barriers or difficulties. I will show you a video for. Okay. Wait a moment. I'm nervous. Well, the documented learning for the students is like this. And you have an e-learning, and like that, for example, religion, culture, and values, no? And it will be, we click on the legend button to see what each element in the learning document means, and you have all the things. You can have links to, or photograph, for example. And well, you have. Is a document very worked and is easy to try. Bueno. And you have, if you want, you have a diagram. All this document, the Department of Methodology of the university make it in base of the PDF of the expert person who give, no? And so they make the document learning. After you have the video conference, this one is with Illuminate. But you can see there is the teacher and the students. After there are the videos, for example, of the experts.
Individuals with behavior problems are individuals who behave in a way that is very different from
Bueno, it's a
the
sample.
behavior either causes problems to others
I
or causes
sorry.
problems to the person who behaves in that way. There are
I showed you the PDF, for example, with the music audition and culture, and you have, quickly, you have, for example, the links, and you can put the links, you can put music if in this here music, but you can put anything. And okay. Bueno, nada, bueno, the course we have. Okay. We have now a master official postgraduate course and postgraduate course that they are not official, and we are waiting. We think probably for 2012 it will be official, the master of elder abuse. So we hope. Thank you for all. I can't.
Our next speaker is Marie Beaulieu from the University of Sherbrooke, and she holds the only chair in elder abuse in Canada, and we think worldwide.
Thank you. Let's not forget that he said that there would be an alarm at 4 o'clock and it's 5 to 4, so. And I was certain it would happen in my time. It's always like that. Okay. Let's see. No. Slideshow. View show. Okay, I got it. So this is the official title of the session, New Developments in Education and Training of Practitioners and Researchers. And like Gloria said, I really want to talk to you about a research chair on elder abuse. I'm from the University of Sherbrooke. In the University of Sherbrooke, we do have a master's degree in gerontology that has been in place for more than 20, I think it's almost 25 years now. And we do have a PhD in gerontology that started 8 years ago. And it's a PhD given in French. However, all the international literature is in English, so it's kind of a very, very bizarre program because the material is in English, but we're doing the seminars in French. And I think that for probably many universities are doing the same thing. I'm also at the Research Center on Aging. That's where my the chair has been placed. In the research center, we are 35 researchers from all disciplines at the university. So we've really been covering from the cell problems to the society problems regarding seniors. And elder abuse has been part of the research program there for many years. So this chair has been launched on November 1st last year, but officially the press conference with the minister was only on December 16th. So I could say that the real work started in January this year. It's a brand new research chair. It's a 5-year funding. And it really comes from the fact that last June, actually June 14th, so a little bit more than a year ago, the Quebec government did launch a government plan of action to counter elder abuse. It's a 5-year plan. This plan is very important because we've been waiting for it for almost 20 years. It's 13 ministries and government agencies together that did put in place this plan. And actually, there's money for implementation. So it's not only things that we wish to do. We have money to do it. There's $20 million for the implementation of this plan. And out of this plan, there are 4 structured actions to counter elder abuse. The first one is a public awareness campaign that is launched each year in October, and it changes. And from one year to the other, we do build on the message. The second one is being the creation of a research chair on elder abuse. The third one is a telephone line of listening and references. And finally, there's a team of regional coordinators in all regions of Quebec. We have 17 regions, but we have 20 coordinators because there's been one coordinator for Aboriginal people and also 2 coordinators regarding cultural issues and ethnic communities. So I know it was raised this morning about the question of sensibility to those issues, and it's really important. All these actions really have to work together. So with the research chair, I'm really in contact with all these people. And actually, just last May, I was training the original coordinators that just started their work. So what are the goals of a research chair? You won't have a lot of surprises. First of all, it's to develop some theoretical, empirical, and practical knowledge regarding elder abuse. It's also the training of highly qualified practitioners and researchers. It's doing evaluation of action regarding prevention, detection, and intervention. And as Lynn McDonald said, regarding intervention, actually, not many things have been really evaluated. And that article you were talking about from Jenny Ploeg and her team a couple of years ago was really shaking the world because we were just thinking, okay, do we really know what we're doing and do we really know the impacts of it? The fourth goal is knowledge transfer to different publics, so scientifics, practitioners, and also the general public. So research results can be actually used to do more general campaigns. And the last one, you won't be surprised too, it's finding funding. When you do research, you need money to do it. So let's just give you an overview about what we're doing right now. So it's a selection from different projects. So probably a few people here do know the tool that was developed in more than 20 years ago by Erdman Palmore in the States. That's the Facts on Aging quiz. It's a very powerful tool, but it has been aging because the results in the tool are based on strong research. Well, actually, in the past 20 years, we do know more. So one of the first things we've been doing is to refresh the tool with actual Quebec and Canadian data, and we've been piloting the tool. And we did exactly the same thing regarding a tool specifically on elder abuse. So it's an elder abuse quiz, and actually we did 2 versions. One is 18 questions for general public, and the other one is for more advanced public. So I can use it when I'm training actually practitioners. It's 25 questions, and all of these questions, there are some more controversial issues because I think it was raised a couple of times today. It's not always black and white in the field of elder abuse, and sometimes you will find some results that actually will say a little bit of the contrary of the other ones. So for those 2 tools, we're now doing a final validation, which is a test and retest validation and also a stability validation. So the data collection is finishing this week, and we intend to publish this summer with that material. The other thing we're doing is actually having a training material on elder abuse in French. When I went out and looked at what was the material there, it was terrible. Like, it's all old stuff and it was not accurate at all. So having some good material to do training. And Lynn McDonald has been talking about In Hand. I've been developing this tool in the past years, doing a lot of training, and one of the things that I realized that practitioners come out of the training session and they say, thank you very much, I really enjoyed, but this has really to change my practice. And to do so, I need the support of my organization. So, and some people are not using it because they're not supported in using it. So we're now writing guidelines for the implementation of the tool in different milieus. And we just realized that now, before actually accepting to go to have a contract for training, we really have to have the organization to say, yes, we will actually make all what is available to have the practitioner to implement it and actually give them time to get used to it and also actually accept to change the practices. We're also doing an inventory of detection tools used by public social and health services in Quebec. Why are we doing that? Because we realize that they're using a series of different tools, and some of those tools actually were just kind of very quickly written, and we don't really know if they're good or not. So we're really trying to have an inventory of all the tools that are used and trying to propose a tool. And finally, Lynn McDonald has been doing a very good presentation on the project defining and measuring elder abuse. And for me, this is a very strong project because, like she said, we're going to have strong definitions in both languages. And it's not always a question of just language. It's a question of culture and using the same words. Like here today, we're in England. We all know that the English in England is not the same one as the English in the States. It's the same thing when we're talking about official translation from English to French. Sometimes the words don't fit. So we've really been testing the material, and we've been doing all the field work at the same time in English and in French. So what the findings in both languages could influence the final version. So we're right now doing the final piloting. It's very, very interesting because we realize how much seniors want to talk about it, have things to say. And actually, at the end of the interviews on the phone right now, they're asking, when will we have the results? So it shows that there's really something needed around that. I am also doing with my research chair what I think is very important, support to NGOs. So a lot of funding programs, they have to have a scientific committee. So I've been approached, and actually they got the money regarding abuse of older transsexuals. And I thought this was a very original project because I never read anything about that. There's also funding for training seniors to do accompaniment in elder abuse situation. So we're not here training professional, but really seniors, and sometimes they can have a very powerful way of action because they're probably less threatening than a professional can be. And also producing a booklet for older women victims of conjugal violence. We went for funding this year, and actually two important projects for me, and that we're waiting for the responses by June 30th, so about in 10 days. The first one will be the development and validation of prevention strategies with different ethnic communities in Canada. So we choose 4 provinces, and in each province 4 groups. And we're really trying to see what can be common approaches, but what has to be nuanced. And so I think it will come. We will have very interesting results with this. And the last project, but not the least, is the impacts of violence among the life course on physical and mental health of seniors. And for this project, I'm with a team of epidemiologists and all these type of works, which I'm not used to be working with. So it's very, very interesting. And actually, we're doing all types of measures, including cortisol and things like that, really to measure stress and trying to see what we can learn from violence at different stages of the life and the impacts on seniors. So we will, in that group, have people who are actually experiencing violence, but others who went through it earlier in their life. So now regarding education and training of actual practitioners. Well, I've been using the tools, but also other approaches. Just to give you a few examples, social and health public services, where I do general training, but also using in-hand and the fact on elder abuse quiz. For the new regional coordinator, I've been using the facts on aging quiz, and it was quite interesting because, as you know, the facts on aging quiz, which is more general, really try to address ageism. And we all know that if you have attitude or behavior, actually it will really impact on your practice. Another thing that I've been doing very recently, a couple of weeks ago, is actually looking at municipal actors, being people from the administration, but also the elected members of city councils. Why? Because there are more and more seniors in our communities. And again, there's a lot of ageist practices. So I was just playing with the quiz and actually facilitating a group. And the theme of the session was, are you an ageist person? And for sure, everybody says no. And then they really realize what are the beliefs and what they have to change. I've been working with community police and also with an NGO that is called in French Baluchon Alzheimer. And I looked in the dictionary, Baluchon is bundle. Okay? So this is home respite workers. And that's very interesting because they go in your home, you go on holiday, and they stay for a week or two with the senior there. So the senior is less disturbed. But they ask for the training on elder abuse because they see a lot of things at home and they didn't know how to react. So future practitioners, well, actually, I can reach them through the bachelor degree in social work, where in the class on aging, I do put in a certain number of hours on elder abuse, and I do the same thing in 2 master's programs, so the one in social work and in gerontology. But I think it's not enough. So what is expected in the next year? I would really like to teach in other disciplines, work with colleagues in nursing, in physiotherapy, and all these other professionals that do actually see things and they're not trained, like the School of Medicine. Actually, my dream would be a unified course of 45 hours for all future practitioners all together to build in interdisciplinary work. I think that we also need college partnership and also the School of Police, because police are not very well trained to work with seniors right for now, and there are some issues on that. Now, for future researchers, for me, it's clear that it's through the PhD in gerontology that I can really raise the awareness there. I'm giving 12 hours on social theory, and I choose this year to really have 3 hours on ageism and 3 other hours on elder abuse. And what I would really love to do, and I was listening to the presentation just before, and I'm thinking I would love to have a seminar on epistemological and methodological issues raised by research and elder abuse. And probably we could do an inter-university kind of seminar on those issues. In the research chair right now, I have 2 PhD, 5 masters, 1 bachelor's student, and also 1 research professional. And the life of a chair is very important. So we have monthly seminars on elder abuse. They're having a lot of engagements in all aspects of research, including doing some representation for the research chair. They're also receiving funding for dissemination and networking, and we're working on emerging themes. Vulnerability issues. You will say it's not emerging. We've been looking at that for many years. But actually, I think it's emerging now because in certain places, we only want to define the victim as being vulnerable. And I'm not certain that's a good path to follow. I can come back on that if you have questions. And also in Quebec, we've been not looking at self-neglect. Self-neglect has always been considered as mental health issue. And now we're trying more and more to include it in the broader definition of elder abuse. So in conclusion, well, having a research chair is a really good infrastructure, and it includes for me not only a bit of money, but less or more focused teaching, so I can really put all my energy on elder abuse. It's important for me to have some partnerships, and I really want to recognize that I'm already having some strong partnerships and I want to build new ones. So my partners are now University of Montreal, McGill, Simon Fraser University, Toronto, Ryerson, Kingston, Caldas, which is in Colombia, and actually they're doing interesting things. It's also in Brazil and in Germany. I need some strong community partnership, especially seniors, NGOs, advocacy group, and third age university. But all the other partnership with practitioners are important, so public, private, and NGOs offering services are there. Very soon I'm going to have a website. I did buy 5 different addresses. I couldn't put the good one on because I don't know which one will be activate. But here is my email address. Please be in touch. A research chair is a way to actually build links, and on that website, I really want to offer a place where people can put some links to their research results. It's a way of sharing the information regarding research. Thank you.
Just in this folder.
Hi, I get to introduce myself because the Irish take over everywhere. I just have to say this is the closest thing I've ever come to speed dating, so I won't be looking for your numbers at the end. You're safe. My name is Mandy Phelan, and I'm a lecturer in the School of Nursing, Midwifery and Health Systems in University College Dublin. I'm also a Programme Director in the National Centre for the Protection of Older People, and I'm also starting a master's level programme for students in September 2011. And I do have a life. So I just wanted to set the context in Ireland before I go into the actual programme. And the Central Statistics Office in Ireland, as you can see, have enumerated the age groups of older people in Ireland. And as you can see, as reflected globally, we live in an ageing population, but it's most predominant in the older old group, specifically 85 plus years. And that's why being more aware of elder abuse and doing something about it is very important. In Ireland, our life expectancies have increased hugely. In 1923, people lived till around 57 years. Currently, we've just finished the census in April of this year, and the results aren't out, but life expectancy at birth is 76.8 for males and 81.6 for females. And even though the Irish Central Statistics Office haven't been able to enumerate their results, the Central Intelligence Agency in the States can tell us in Ireland, so they're watching everywhere, that estimates for 2011 are 80.19 for both genders, 77.96 for males and 82.55 for females. Well, it is government policy in Ireland that only 5% of older people will reside in residential care. I won't dwell on this slide because Protecting Our Future document has jumped since I looked at it last, but my colleague Karina already went through the policy document. I just want to look, Ireland doesn't have legislation specific to elder abuse, but we do have related legislation that can be used if an abuse has been perpetrated. And I just have bolded the Lunacy Regulation Act in Ireland from 1871. And this is currently going to be dumped by the Law Reform Commission, have proposed that we have a renewed Mental Capacity Act, and this is due for debate in our House of Parliament, which is called the Dáil. So now you know you've learnt an Irish word. We have Power of Attorney Act in Ireland, which is hugely underused in comparison to our UK partners, and also we have various amendments to the Health Act which are protecting older people who are in residential care. And interestingly, in terms of financial abuse, there are proposals in terms of looking at the laws of agency and protecting people specifically in that way. In Ireland, since 2007, we have the Health Information and Quality Authority, and they really, a huge catalyst to the formation of this body was a prime time investigate programme which was screened on the 31st of May 2005 in Ireland, and this was undercover filming in a residential care facility which showed huge abuses being perpetrated, and the public the public outlash after that led to the government setting up HICWA. And the standards, and they look after any person, regardless of age, who is in government residential care. In terms of older people, there are 32 standards which are delineated, and they cover the areas which are up on the screen. As a proposal for Protecting Our Future, the National Centre for the Protection of Older People was set up in 2008. And the objectives are up on the screen there. And it is led by the School of Nursing, Midwifery and Health Systems, but it is also in cooperation with the School of Medicine and the School of Population Health and Public Health, the Geary Institute and the School of Social Policy. Have I left anyone out? They're all in. So we have a multidisciplinary programme board there, and we have done the major piece of work was undertaken by Crean and colleagues in last year, the prevalence study. In terms of the programme we're running, this is a multidisciplinary programme in the UCD School of Nursing, Midwifery and Health Systems, and applicants, the prerequisite is that the person must work with older people. It doesn't matter in whether it's health and social care, if it's in the Gardaí, which is the Irish Police Service, if it's in the legal system. And one of the reasons for this is that we have an action-based assessment process, which I'll talk about in a minute. It's an MSc level programme at 15 credits. And the applicant must have academic level 8, which is a higher diploma or a degree. But they may bypass that if they apply through accredited prior experiential learning. And this is where they simply apply and use their experience as a basis for application. And then the prerequisite of having level 8 can be waived. What we'll be doing is it's a provision of in-depth, up-to-date knowledge about key issues in all aspects of elder abuse. So we'll be looking at detection, reporting, investigation, caring for victims, prevention of elder abuse in acute, chronic and community care. And the programme will also cover contextual issues such as ageism, mental capacity and the sociology of ageing. And we're lucky enough to have the Law Reform Commission physically involved in delivering the programme, and they will talk about the legal aspects and also the proposals that are coming up in the next year or so. It is mainly a blended learning programme, so the students it's one semester, the students come in 3 days. The other weeks they access their lecture online at a time that suits them. So it's not synchronous, it's asynchronous, and this will suit people from around the country, people who are in different work shifts, because they can do it at a time that suits them during the week. We use Blackboard, which is a virtual learning environment, and it supports online learning and teaching. And the students will attend multidisciplinary lectures and tutorials. At the moment, as far as I know, our capacity is 15, and this is because we do a lot of small group teaching. And also, we've almost filled the programme for September. There are mainly nursing background, social work background. We've also had people from the police inquire and the legal background. The assessment is action-based learning, so people on the programme, students on the programme, will actually have to make a change in their own work area. So they'll have to reflect on the area that they're working on, and like an action research project, their assignments will be based on taking one specific issue in relation to elder abuse and making that change, and their final assignment is writing up that change. They will also be contributing to blogs, discussion boards. They'll have to do a presentation in week 5. I'm sure they'll be delighted on week 1 to be told that, and 2 assignments. We're setting it up as a ladder, so the students can come in and do a professional cert at 15 credits. They can walk away with that qualification, or they can bank those credits and work up to a master's. So this allows people to say, well, I can do it that semester. They can come back within 5 years and complete a master's. So that gives a little bit of flexibility for people who may have financial problems. And as you all know, Ireland, banks, bad word. But it does give somewhat leeway. I just wanted to talk about the things we've just done in Ireland this week as well. We had a huge conference in UCD, and this was attended by over 300 people. We had to turn people away. And the Minister of state with responsibility for, they've changed all the terms now, equality, disability, mental health and older people, launched the conference. And we had many centres around the country who did things like they lit candles to acknowledge those who have suffered abuse. There was purple ribbons, balloon releases, music sessions, mass in interdenominational prayers. There was one area that they were going out on a bus outing and they were covering the bus with balloons. And I had this vision, if anyone has seen the film Up, I had this vision of the bus taking off with purple balloons and people would think Harry Potter is flying around Ireland. There was interactions with school children, conversations on respect and dignity for older people. The Garda, the Irish Police, in some centres were visiting residential care, and also the development of resident appreciation boards and self-reflection memos by staff. And the staff were asked to write what would they like their life to be like when they get over 65. We had the Lord Mayor of Dublin, who's a good friend of Attractus down there, come to sign a declaration at the conference, and we also had the mayors of all these areas also sign. And we had the Deputy Commissioner, the second in command basically of the Irish Police, come and sign municipal declaration, and also our head of school, Dr. Martin McNamara. And Sinead, thank you for listening.